Hi guys, I'm Judy Tompkins. Welcome back. We're here at New York Skin and Vein Center, and we're going to talk to Dr. D and try to get some answers because we need to know what's going on. I see a lot of changes in my skin. I don't know if it's the weather, but I know that all of us are experiencing some kind of dryness or some kind of changes. We want some answers. Dr. D is seeing a patient right now, but he's going to be right out and talk with us. Well, we're here at New York Skin and Vein Center, and we're talking to Dr. Eric Dohner, our own Dr. D. Finally, we got a moment. Thanks for joining us, Dr. D.
You're welcome. Thanks for having me.
Well, you know, I told my viewers this is the mission. I've got changes I've seen going on with my skin, and I know that it's kind of a skin maintenance issue, but I really want to come to the expert. What are the basics of taking care of your complexion so we look as young as we feel?
Well, things have changed a little bit in the past few years in terms of what you need to be doing.
Now, how has it changed?
Well, we used to say moisturizing was a big part of it, but many experts are now saying don't moisturize.
Don't moisturize?
Don't moisturize.
Why? Well, I can't believe that.
Well, because moisturizing suppresses your own natural moisturizer, one, and two, can also cause a lot of oily skin, outbreaks, etc.
So what's the basics? What do we start with?
Well, cleansing is the most important one.
Okay.
And you just need a good cleanser that removes the impurities, cleans out the pores, things like that.
What's the next step?
Well, the next step is to activate.
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 What's activate? Is this exfoliate?
This
activate?
is exfoliation. This is exfoliation.
Okay.
Plus a little bit of mechanical stimulation of your face. All right.
Mechanical. What do you think? Massage your face?
Yeah, a little bit of massage. Okay. In the shower when you're washing and exfoliating. And you don't have to exfoliate every day. Probably twice a week is good enough. Okay. Especially for people who have more sensitive skin. All right.
So when you're exfoliating, you're sloughing off the dead cells or something like that. I've always heard.
Yep.
Okay, so we cleanse it, and then twice a week we exfoliate, which is part of activation, or that is activation?
That is activation, but also, once again, mechanical activation, stimulation of your skin. If you look at boxers, all right, who've been beaten up like crazy, they have young baby-looking faces.
So you're advocating taking a boxing part-time or something? That would probably activate your face. Oh, my.
Yeah.
Huh. Interesting. Never thought of that because they always hear, don't touch your face, don't touch your face. Okay, so that's 2 steps. What else do we got?
Well, the next one is stimulate.
Stimulate. Wait, aren't you stimulating when you massage?
Yeah, a little bit, but the stimulation part is actually using a retinol or tretinoin. They're both in the same families.
Is that kind of like an acid? I've heard of retin A acid or something.
It's not an acid. This is vitamin A.
Okay.
All right, and vitamin A is the most important thing you can be putting on your skin.
So we're cleansing, we're activating, we're stimulating with the retinol A.
Right. And the other thing about vitamin A is and tretinoin. Tretinoin is the only product that has been clinically shown to actually reduce wrinkles. So it's a very important
Now, is this a new
molecule.
cutting-edge product? I've never heard of it. Not that I've heard of much, but...
Well, you haven't heard of the generic name tretinoin, but you've heard of retin A. Retin A
I've
is
heard of
used a
retin
lot.
A, but I've never heard of
Exactly.
tretinoin.
And there are many different products out there made by different manufacturers. And I like to say, when you turn 30, your skin says, I got you married, got your career, got your kids, I'm going to sleep.
Oh, dear.
So the point of tretinoin is to wake it up.
Okay. Huh. So this is what you advocate for your patients.
Yes.
Okay. So we've got those 1, 2, 3. Is that all of the stimulate? Or the stimulate and the agitate? Okay, agitate. Agitating.
And sometimes you have to calm it down. And that's where moisturizers can sometimes help. Okay. But for the most part, you don't need moisturizers.
Well, how do you know when you need to calm it down?
Well, you got to talk to your doctor. You have to see how dry you actually are.
Okay, so if you're starting to get dry, that means you need to calm it down.
Maybe.
Okay. Sometimes I've started at some of these regimens over the years, and I confess I haven't kept a regular regimen, and I'm going to now, believe me. But I get to the point where something happens, and it seems like it gets worse, and I'm like, wait a minute, and I spaz out, and I'm not going to do this. Let's take off a couple of weeks, and then I take off like a long time. So does it get worse before it gets better?
That's actually a very astute comment. And the reason is this. When you're starting any retinols, retin A, tretinoin, all in the same family, it's expected that you're going to be a little red, a little peely, a little tight, a little itchy. That's an expected reaction. That's not an adverse reaction.
It doesn't look good. It doesn't look good.
Well, if you have important things to do, you can just cut back on the frequency. So instead of doing it every night,
Is it once a day usually?
Once a day. You have to use it at nighttime.
Okay.
Because these products are inactivated by light.
Oh.
So if you put it on in the morning, it's not going to work.
Interesting.
You also cannot use them with moisturizers because moisturizers inactivate them. So you have to use it at night after a cleanser and you're done with your skin.
Okay, so we're at the calm down. Now, is there anything else?
Protection.
So that's when we go out in the sun.
Mm-hmm.
Okay. Now, does everybody need that?
Everybody does.
Everybody needs that. And that's SPF, what is it, 15,
45,
75?
30, 45, 75, 100. You're probably not getting much after 30 or 45.
That's what I heard. You know, when you get to SPF 30, you know, you're like more or less covering all your bases. So is that all year too? Like if we're up here in upstate New York. It's not like we see so much sun. Do I still need to use it?
Yes, you do.
Even if I don't go outside too, I still need to use it?
Well, everybody goes outside.
I guess a little bit. Okay, so is that everything?
That's everything.
So that's everything. So how long till I'm going to see a change?
Well, if you intensively use these products.
Now, intensively, you mean what? Regularly?
Every day.
Every day.
Stick with them.
Okay.
And if you have issues with muddy appearing skin and brown spots and freckles, uneven skin tones, you're going to see a huge difference in only 6 weeks.
In 6 weeks?
6 weeks.
Is that guaranteed?
Cross my heart.
Cross your heart? Well, that sounds like, geez, maybe I could do it. So you have a couple lines that you sell here. Is there anything you can advocate for perhaps people that aren't a tight budget, just over the counter, that they could do some sort of cleansing system?
Well, sure. I mean, just plain old Cetaphil is a great cleanser that you can use to clean out your pores. Doesn't leave any heavy residue on your face. And there's a lot of different lines out there over the counter that have retinols in them. This is also the vitamin A that I talked about that can be very effective.
Well, that's good. That's very helpful to our viewers, and I know that they appreciate it. So thanks for seeing us and solving some of our problems here. We'll probably be back again, I'm thinking. But anyway, you're off to a birthday party for a patient that's 100 years old?
She's turning 100 years old this weekend.
That's great.
Several years ago, I said, when you turn 100, I'm going to have my picture taken with you, and she kept me to my promise.
Well, she remembered. That's good. Have a great time, and thanks again for joining us. I appreciate it. Here again, Judy Tompkins, and stay with us. We'll be right back.